Okay, Lily, I'll introduce you now so that we keep to time. It is with great pleasure that I'd like to welcome Lily Collison to our seminar series for the Trinity Research and Childhood Centre. The aim of our centre is to promote children's health and well-being across the lifespan. Lily is a globally recognised advocate for individuals with cerebral palsy, whose work has significantly impacted the field of CP research and healthcare. She has played a pivotal role in helping establish 3 major research hubs at UCC, Trinity, and RCSI, and aims to revolutionise the landscape of CP care in the country, which is enormous. I think this is an incredible achievement, Lily. She has written and co-authored a lot of books, and she will tell you more about that herself. And this year she was awarded an honorary doctorate in medicine by University, UCC. I'm going to open the floor to you, Lily, and thank you very much for joining us today.
Thank you, Professor Coyne, for inviting me here today. And as the slide says, I'm going to talk about impact versus achievement in paediatric research. And I'll first talk about my circuitous route to here. I'm actually a science graduate of Trinity, more moons ago than I'd care to admit. I had a long career in industry and education, and I worked in Abbott Laboratories, analog devices, in the area of quality management. In 1989, I set up my own company, SQT Training, which provided training in many international standards, such as ISO 9000, and in areas such as Lean Six Sigma. And I was MD of that company for about 25 years. And though the company is still thriving, I'm long since retired from it. I have 3 children, now all adults, and my youngest son, Tommy, received a diagnosis of cerebral palsy, CP, in 1995. And when Tommy was diagnosed with cerebral palsy, I didn't even know what the term meant. And Tommy has spastic diplegia, that type of CP, and that largely affects his walking. He's now age 30, and though his disability is moderate, his outcome is very mild. He graduated from NYU in New York and is now working in tech in California. He's married and has just had a beautiful baby girl. And I regularly check in with him that he doesn't mind me talking about his CP, because I suppose him having CP is what brought me into this whole field. But I regularly ask him, are you sure you don't mind me talking, that it was through him having a diagnosis of CP that led me into this area. Tommy was lucky because we were able to access good care. And so he was born in 1994, and back in the 90s here in Ireland, there were excellent therapies. We had excellent PT, speech and language, OT, where we lived between Tipperary and Limerick. We really had good community services, so good community services did work, and I accept that wasn't the picture countrywide. When Tommy was aged 9, he had orthopedic surgery at Gillette Children's Hospital in Minnesota. Now, Gillette Children's Hospital in Minnesota is a specialty hospital that treats complex physical and neurological conditions. So it doesn't have an emergency department or anything like that. It's a specialist hospital that just treats physical and neurological conditions. So it does it treats things like conditions like cerebral palsy, spina bifida, epilepsy, conditions like that. So Tommy, when he was aged 9, had surgery there, and he had surgery there under the world-renowned CP orthopedic surgeon Jim Gage, who is long since retired. And at that time, he had what's called SEMLs, single event multi-level surgery, right? And just to give you an idea, in one operation, he had 13 procedures at hip, knee, and feet level, right? Some mostly on one leg, but on both legs. But if you can imagine a hip operation, knee operations, and feet operations all in one surgery, right? And like we're talking about both bone and muscle surgery. And like he went into surgery walking, but it took almost 2 years to see the full benefit of the surgery. And we're talking about, he had that surgery 21 years ago. And I had the confidence, remember 21 years ago, there wasn't the internet that we have today, but I had the confidence to bring him to the US for surgery on the basis of 2 papers, right? One was an update on the treatment of gait problems in CP, right? And this was, this article summarizes, so if you see the authors, Jim Gage, Tom Novacek, and this article summarizes our experience with CP over the past 20 years. So this was an update on their treatment. So I had that paper was published in 2000. Now remember, we were going for surgery, the year was 2004. And there was a second paper, Comprehensive Treatment of Ambulatory Children with CP. So this was a retrospective study used to evaluate the outcome of treatment of 135 children with CP. They were children with spastic diplegia. And if you look to the bottom of the summary, it says a significant majority of subjects, 79%, improved on a predominance of outcome measures, and only 7% of subjects worsened. So I had this paper. This paper was published in 2004. Tommy had his surgery in 2004. So this paper was published just before he had the surgery, right? And the point I'm making about these 2 papers were those 2 research papers were what gave me the confidence to take him abroad for surgery. And that was when a lot of friends who are medics, people who had our best interests at heart were telling me, don't go to America, don't go to America. There was not one person who supported the decision to go to America. Nobody said go, and people were saying, a lot of people said don't go. And one of the comments was, they cut too much in America. But those 2 papers, and the point I'm making is, the importance of research, those 2 papers. And remember, it said a significant majority of subjects, 79%, improved on a predominance of outcome measures. It wasn't saying that 100%, but it's the research like really spoke to me at the time. I ended up writing up, so if you just go back to the earlier paper was Jim Gage and Tom Novacek. I'll come back to Tom. And the second paper, the last 2 authors are Tom and Jim Gage, right? I asked Dr. Gage, so I was bringing Tommy 21 years ago for the surgery. I asked him, could I write it up as a case study? Could I evaluate the outcome of the surgery? And, so I did. I actually wrote it up as a case study for a master's at UCD. And what I was doing was, I wrote it up as a case study, the procedures done, all that. But how do you evaluate outcome of a surgery? How does a 9-year-old, so Tommy was 9 at the time, how does he judge that huge intervention in his life where he had to leave school for a number of months, go to the States, have this major surgery, have a long rehab. And in fact, the rehab was much more challenging than the surgery itself. The surgery itself was relatively straightforward. The rehab was very intense. How does a child judge that was worth it? How does the parent, and in this case, it was my husband because I was the researcher, how does the parent judge that was a worthwhile intervention? And how does the clinician judge? Like, how did Dr. Gage judge that was, a positive outcome from that surgery? And like, everybody is judging it in their own language. The 3 people, the child, the surgeon, and the parent, judged it to be very successful, though they expressed that in different languages. Tommy said, I'm able to keep up with my friends at school. The surgeon judged that his gait kinematics had improved, his energy consumption in walking had improved, had decreased. So I was just very interested in the different ways people judge outcome. And, you know, it was funny when even though this was the world-renowned surgeon, he had no problem with me, you know, doing a case study on it. And his only condition on it was that I give him the results, that he can spread them to other people, you know, that he could share the results. Of course he could. And as I said earlier, Tommy is now in his 30s. And that surgery he had when he was 9 was pivotal in his life. Getting the right surgery at the right time, it was definitely a defining moment in his life. And like, my proudest achievement in life is definitely that he got the right surgery at the right time. And like, that's actually the Sloan Care point, the right treatment, right time, right place. You know what I mean? It really is true. And like, as I said, Tommy's now in his 30s, like has had many, you know, when he was married, when he had his first child, he would still send photographs to Jim Gage, you know, that it was that pivotal in his life. So fast forward, having been working hard for 35 years, I took early retirement. At this stage, all my children were adults and were living in the US. Tommy had already graduated college and was in the workforce. I started doing retirement really well for a few years, including things like I cycled with my husband. We cycled 3,000 kilometers across Europe from the west coast of France over to Budapest with just what we carried on our bikes. Another time we got ferried to Le Havre, got off the ferry on our bikes in Le Havre and cycled to the Mediterranean, again with just what we carried on our bikes. Another time, actually between two bouts of COVID, when travel was allowed again, when travel opened up again, we did a 5-month camper trip across Europe, visiting a camper. It was obviously the most safest way of doing it at that time, but travel was allowed, countries were open again, and we visited 19 countries. And I have to say, if you ever want to visit Europe, visit it when there's no tourists. Like, we were able to see Europe at the time with no tourists. So if retirement was a Leaving Cert subject, I think I would have been scoring an A+, right, at that stage. And I then decided to go back and write a book. The book I had wanted when Tommy was first diagnosed. I wanted to write the roadmap for that condition, because I found, even though, you know, I had a degree in science and that, I found spastic diplegia, cerebral palsy, a very complex condition because it changes as the child grows. You know, the child at 1 is different to the child at 5, is different to the teenager. And it's just a complex condition. Like, you know, a condition like, say, type 1 diabetes, you know, that's kind of a much more, I'm not saying that's not a complex condition to manage, but it's a much more straightforward condition to understand. CP is complex. So I decided to write the book, which was a deep medical dive into the condition to explain the condition, and separately included the lived experience. So there was kind of 2 books in one, a deep medical dive into the condition and the lived experience. And I wrote for that parent grappling with understanding a complex condition. I approached Gillette Children's in Minnesota, the hospital, and I said to them, lads, I'll research and write the book if you edit it. And I did absolutely no market research. I wrote based on a sample size of 1, the book I had wanted. And that book, Spastic Diplegia, was published in 2020, right before COVID. It was actually published on the 3rd of March 2020. And if you remember, Leo Varadkar was in Washington for St. Patrick's Day when he made that big speech, you know, that pivotal speech for COVID. So this book came out right before COVID. And no one was more surprised than I was when the book sold really well worldwide. No one was more surprised than I was when it was as popular with medical professionals as it was with families. Like, one orthopedic surgeon here said to me, it's the first book he tells new people on service to read you know, it was that book on spastic diplegia. And no one was more surprised than I that requests would start coming in for translations. You know, requests came in for Chinese, for German. And like I immediately, and I'll probably forget to say this, all proceeds from any book I've been involved with, all proceeds go to research. This was, you know, any money that's made from any of the books goes straight to research. See, I do believe in the impact of research. And if you notice on the bottom of, you know, the cover, Tom Novacek was one of the editors. So he has been on this journey with me. So that book was published in 2020, for a long number of years. That book then led to a second book. And obviously I have no experience, like while I always liked writing as part of my work, I had never been an author before. This was my first foray into writing a book. But anyway, it led to a second book, Pure Grit. It was the story of, this book is the story of remarkable people living with physical disability. So I co-wrote this with Cara Buckley. Cara was at the time senior advisor to the US Olympic and Paralympic Committee in the US. And we co-wrote that book where we interviewed people who are flourishing in life despite or because of having a physical disability. So we interviewed Paralympians, we interviewed people who are very successful in business, in the arts. And it was a very interesting book because we did it during COVID. We brought it out for the 21 Olympics and Paralympics in time for that. We did it during COVID and we got to interview people across the world over Zoom. And remember, during COVID, you know, people were very much at home, so everybody said yes. And like we interviewed for that book people like an Irish Paralympian, Patrick Flanagan. We also interviewed, just to mention the Irish people, Robin Barnett. Robin was the former British ambassador to Poland and Ireland. He's about, at this stage, he's probably about 7 years ago, but he had cerebral palsy, he had spastic hemiplegia. We also interviewed Tom Shakespeare, some of you would know him, also Judy Heumann, who sadly passed away. And Judy was probably the Martin Luther King equivalent of the disability movement. Where he was civil rights, she certainly was the equivalent in the disability movement in the US. So that was a very interesting book in terms of interviewing people and telling their stories. Anyway, going back to the first book on spastic diplegia, I realized that was about one condition, and it, you know, like the reaction to it, I was kind of dumbfounded by the reaction to it. So I went back to the hospital and I said, like, they treat complex physical and neurological conditions, and it seemed entirely logical to me. Why not extend from one book into a series? And like, as a recent, you know, sort of, I had written both sides of that story, the deep medical dive and the family story. And I suggested to them, why don't we form teams at the hospital with a team of clinicians writing the medical content and a family they treat contributing the lived experience? And for example, spine surgeons could write a book on scoliosis and a family they treat contribute the family story. The hospital said, yes, great idea, provided you come to work for us and lead the project. So I took up a role as program director at the hospital. So you can see where my Leaving Cert score in retirement is going. I became the Mrs. Doyle with her teapot at Gillette Children's, going around, go on, go on, go on. Of course you have time to write a book. Whoever said clinicians are busy people? Mrs. Doyle and her teapot could get them to sign up, and we did a series of 9 books. We started writing the series in January 2023, and by March of this year, 6 books were published. Let me move on. So there's the 6 books that were published by March of this year. And if you look at it, there's on the top left, spastic hemiplegia, bottom left, spastic quadriplegia, middle, spastic diplegia. I did it, so it was the first edition was 5 years old, so I did a second edition to bring it in line with the series. And then there's craniosynostosis, where the bones of the skull fuse too early, idiopathic scoliosis, scoliosis with no known cause, and epilepsy. So they were the first 6 books in the series, and we call the series the Gillette Children's Healthcare Series, right? So those 6 books were published, and we actually had a lovely book launch here in Trinity for the Irish book launch. We had it here in Trinity in March of this year, and it was in March, and the weather was just amazing. The magnolia were all in bloom, and it was a very, I found it a very emotional evening to come back to Trinity for the Irish launch of these books. There were about 6 people from Gillette Children's Hospital over in Dublin for the launch, and it was lovely to come full circle, to come back to Trinity for that launch. It was a huge volume of work, because I'm either I was either co-author or co-editor of the 6 books, you know. So there was, as I say, we started in January 2023, so there was a significant volume of work to get the 6 books published this year. So that's 6 of the 9, and there's the last 3. The last 3 are on non-idiopathic scoliosis. So about 80% of scoliosis is idiopathic, no cause. About 20% is due to causes such as congenital, neuromuscular, due to a syndrome. So the second scoliosis book is for the 20% of patients who have a cause for their scoliosis, and that type of scoliosis is generally more complex. Spina bifida so the non-idiopathic scoliosis will be published next month in October of this year. Spina bifida and osteogenesis imperfecta will both be out next year. That's the job, my job done. And the funny thing is, I said I would do the 9 and I'm finished then. But what I'm delighted to say is there are doctors coming forward wanting to write other books. So the framework is all there, but I'm delighted that they want to continue the series. Right. And actually, we even got the cover of one of the books up in Times Square in March for March is Cerebral Palsy month. So somebody organised for the cover of one of the books to get showing in Times Square. It's very impactful in the sense that, you know, to have disability in Times Square, it was just, you know, it was quite cool. And the 9 books are known as the Gillette Children's Healthcare Series. Moving on, a piece of research I came across when writing the first book that really influenced me was a paper that showed, so it was a paper on participation and health-related quality of life in adults with spastic bilateral CP and the role of self-efficacy. And like, I'm sure everybody in the audience here today knows that spastic bilateral, in Europe and Australia, they sort of talk about bilateral CP or unilateral CP, unilateral being spastic hemiplegia, bilateral being spastic diplegia and quadriplegia, where both sides of the body are affected. But this paper by Wilma van der Slot, it was the first time it had hit me, you know, that I had seen that people with spastic diplegia, which is largely a mild to moderate physical disability, largely without a cognitive involvement, but they had lower rates of employment, lower rates of relationships, and lower rates of having children. And other research bears out this finding, but it really bothered me that people with just a mild to moderate physical disability without cognitive impairment, as spastic diplegia generally is, have lower rates of participation in society. That paper actually went to my heart. And like, you know, it stuck with me, and I've had discussions with Wilma since, you know, that I sort of blame her, that she has caused me an awful lot of work by that paper. But so it really did bother me. And like, my son Tommy is fine, but I care deeply about all the other Tommies in Ireland. And again, I point out the impact of research. And the first book, that book on spastic diplegia, led to me being invited by the Cerebral Palsy Foundation in New York to join its board. And that led to me co-founding the Irish Cerebral Palsy Programme of Excellence. And that was our 2020. It was founded in 2023 as a 5-year programme, and that was the progress report for 2024. And the goal of the programme is to ensure that every individual with cerebral palsy in Ireland receives the right care in the right place at the right time. You know, it's really important that everybody gets the right care in the right place at the right time. And obviously, cerebral palsy is a childhood acquired condition, but it's lifelong. Yeah, and as I mentioned, it was officially launched in 2023, and it's a 5-year initiative. The programme is built on 4 pillars: clinical implementation, like implementing evidence-based best practice into clinical care; research, conducting, as it says, high-quality research; policy and advocacy; and education and training. They're the 4 pillars that underpin the programme. And the programme is led by senior Irish clinicians, researchers, and the Cerebral Palsy Foundation, and it's backed by private funding and research grants. And I know some people involved with the programme may be here today. And as Professor Coyne mentioned, it's organised around 3 age groups. The 0-2s is led out of UCC. The children and adolescents, the 3 to 17-year-olds, is led out of Trinity, and adults led out of RCSI. And obviously, it's across the lifespan, so we divided, there's research hubs at each of the 3 centres, you know, addressing those 3 age groups, but everybody works together. And formally embedding this programme within the health system as a national clinical programme will ensure its long-term sustainability. And then that programme led me to me being invited to join the board of the HSE. And I remember when the minister called me to ask me to join the board, my immediate reply was, "But I'm advocating strongly for improved CP care. Is that not a conflict of interest?" And his immediate reply to me was, "Not alone was it not a conflict of interest, but if I wasn't advocating for something, I wouldn't be suitable to represent the voice of the patient on the board of the HSE." You can see now where my grade in my Leaving Cert retirement is going. I'll finish up, I'll finish up to allow some time for questions, but a few thoughts on paediatric research. And everybody in this room knows that infants and children are very neglected in medical research worldwide. Like, adults aren't neglected, children are. Now, I know it's improving, but it still has a ways to go. And I always say we need to be brave and bold and laser focused on, for example, the prevention, cure of early brain injury. We need the equivalent of a moon landing programme for that. And we need the evidence-based best practice care across the lifespan for those with disability. And I always say, children are our future. And like, there are less children than there are adults in the world. But if you measure it in life years, you know, children are so important. And like I always, you know, children in Ireland with early brain injury, children with disability, their outcome should only be limited by medical science, not by postal code. You know, the children in Ireland, they have to be limited only by medical science, not by living in Ireland. And we need to keep pushing that medical science forward. A few thoughts on more thoughts on impact versus achievement. Success for any of us is not about personal achievement. It's about impact. Success for any organisation is not about organisational achievement. It's about impact. Don't ever think of the number of papers published. Think of the number of people impacted. I'd also add about the power of one. I would encourage you all, everybody in this Zoom room, to never underestimate your power of one. I was happily retired with my A+ in retirement and then decided to write a book. One book led to 10 more books. I'm only one person. We all have powers of one. There are whatever number of people in this room. If we all used our powers of one, think about it, you know, the collective powers of one of all the people in this room. So my two takeaways are impact versus achievement in research, and use your power of one. That's it.
Thank you so much, Lily. That was so interesting. I was busy scribbling down some key points, so I gained a lot myself from listening to your talk and your experiences. And we've had some questions coming in. I think a comment from Anne, who we know quite well, Anne Lawler. Lily, I think you're a fully paid up member of the informal Don't Mess with the Lioness Club. Was given to our intuition as mothers. We so need patient and family reported outcomes as a given in our healthcare system. And also she went on to say, I do wish that as mothers, more credence was given to our intuition. And Eleanor said, thanks for an inspiring talk. You're a great example of the power of one. I have a question for you, Lily, and that is, reflecting back on your experiences as a parent and an advocate and a mother, what was the most important support for you when Tommy was, having to undergo these treatments and things? What was the most important support for you? Yeah.
It's funny, you never realize, and I've said this before, and actually this physiotherapist was actually at the book launch in Trinity in March. But when in the early days when Tommy was diagnosed, there was this physiotherapist in Tipperary who had just come back from Great Ormond Street, right? And she fed my thirst for knowledge. She fed me she knew I was really trying to understand it, and she fed me like she gave me a 1991 book published by Gillette, you know what I mean? So in a sense, she was the person who pointed me first to Gillette in the US, you know what I mean? And I would say she was a very important person, that she really supported me. And I think many families who have a child with a disability can probably identify a professional who really supported them. And, you know, she did, and she was always very supportive in her journey. So I would say that, you know, you meet people along the way who support you, and I would identify her as, you know, a very important person in our journey.
Very good. And another question I have for you, and it's great to hear that you're on the HSE board and, you know, at that seat of influence, is what do you feel needs to change or improve to ensure that all children like your Tommy get the support that they deserve?
How long have we?
Sorry, I know it's a big question, but take your time. Take your time.
There is a lot to be done. There's a lot to be done. You know what I mean? Like I think children, like as I always say, adults are fully grown. adults with conditions are fully grown. Children are growing in the presence of a condition, like say a child with cerebral palsy, they're growing, or a child with scoliosis, they're growing while they have the condition. An adult is different, they're fully grown. I think we've to really, like the whole thing of waiting lists and that for children who are, growing in the presence of things like scoliosis, like we really, there's a lot of work to be done with children, you know what I mean? And like I'm passionate about, children, about people with disability. We've a lot of work to be done there, and it is certainly on my radar.
Very good. And then I'll just check the questions here. I think Anne had a question or just a comment to say that those books are a great idea, Lily. Could we do similar in the New Children's Hospital? There's a dire need when it comes to the complex care needs of individually rare, collectively common diseases. And the scoliosis book is a good example of a common symptom of many syndromic conditions. It's part of other conditions.
Yeah.
So,
Like when a child gets diagnosis, you need the car manual for that diagnosis. You know what I mean? And like obviously rare, it doesn't matter even if the condition is rare, you really, it's like you really do need that support when you have a diagnosis. So like and as I say, like I was surprised at the reaction to the first book. I'm delighted that we have 9, but there's far more than 9 conditions. You know what I mean? We need it for a lot more conditions. You know what I mean? And like I'm delighted to see teams at Gillette, coming. Like we started. That was the what we started on. I'm delighted to see want to book on this, want to book on this. That the genie is out of the bottle now. But there's enough. Like there's an awful lot of conditions, and like it's tough enough for families to have to deal with condition without knowledge, lack of knowledge and lack of understanding. And like when I was writing the books, when we're writing the books, we're not coming up with any new knowledge. The knowledge is there. The knowledge is in the heads of the professionals. And I just, like, the skill we had in writing the books was taking the knowledge and knowledge translation, making it accessible to families, not dumbing it down. Like I wasn't interested in dumbing it down. The skill in writing the books was translating the most up-to-date medical science and clinical care into information that was accessible by families. Sort of that like the last thing I would ever have wanted was something dumbed down. I wanted it clearly explained. So the skill in writing the books was making sort of deep knowledge accessible to families. And like, as I say, that's only 9 titles. How many conditions are there? There should be a car manual equivalent for each book or for each diagnosis.
And that's an excellent point. Like it's translating that deep knowledge and having it there in easily understandable a language for parents so that they can be a support and an advocate for their child.
Yeah, absolutely. And I think that'll help move things forward a lot. It's that greater understanding, you know what I mean? And like, you sort of, like not everybody is willing to buy it, and we try and keep that price, the ebooks are all priced at €10, that sort of price. So that price is not a barrier for anyone. Printing a full color book is expensive, because they're all full color books. But the ebooks are all priced at €10 or $10, you know what I mean, to make price not the only, people have to be willing to read, families have to be willing to read a 300-page book. That's not every family, but a lot of families are willing to read, they want to know about their child's condition. And we, as, in writing the books, would have failed if we didn't make it accessible to someone who's willing to read a longer book. You know what I mean? You know, and as I always said, the test was someone who's willing to read that size of book. If they can't, if it's not fully accessible to them, we failed. And we were very careful about that, that it was not dumbed down, no, you know, not dumbed down, just clearly accessible. You know, and it's up to the researchers. Like, as I say, we were taking this, you know, where things are now. We obviously need to keep pushing forward on the research, keep advancing the medical science. That's the, you know, that's a different day's work. But we took where we're at now and put it into accessible to families. But I always say, keep moving the medical science forward.
Yeah, and making it accessible to parents at that cheap price is excellent, because then it's not prohibitive for them to buy an ebook.
Yeah.
Another interesting point that came up from your talk was that you said that, you know, when you were writing your book about your experience with your son, the outcome for him was quite different from the healthcare professional, you know, that he wanted to be able to, walk normally?
No. The point I was making there was they just spoke to like a 9-year-old. He, you know, the clinician matched, you know, sort of, they all judged it to be successful, though a 9-year-old would use different language when he was describing the success as the clinician would use, you know, the clinician, you know, but they were like, if my son could keep up with his friends, it meant that his oxygen consumption and walking had decreased, and that's what the test showed.
Yeah, but on that point about him keeping up with his friends, there's a lot of research with children where they will have a preference for an outcome that might be slightly different than the healthcare professional or than the parent. They want to live normal lives, you know. And I just wondered, from the other books that you did you find, did that come out when parents were telling their stories? That their children might have had a different perspective or a different preference for an outcome.
Well, I'm just thinking in Pure Grit, one of the stories where the one of the Paralympians, where he wanted to use a wheelchair in school, but his parents were trying to keep him using a walker as long as possible. He wanted to get into the wheelchair because he could play better in the playground. You know, he could keep up with his friends, you know what I mean? And that was far more important, whereas the family were trying to keep him walking as long as possible. He couldn't wait to get into the wheelchair and keep up with everybody, you know. And that's a kind of a case of where, you know, everybody is trying to do their best. The child just wanted to get into the wheelchair and get on with it.
And that's a very good example, because I think sometimes as healthcare professionals, we don't ask children what they want, nor do we consider that their objectives could be different than what we want as parents or what we want as healthcare professionals. You know, so that's really important. I had one more final question, which for myself is here. You know, you mentioned about, you know, this matters because children grow up, they become adults, and now Tommy is married and everything and having a good life. How do we get across the importance of this life course perspective, that, you know, what happens in childhood is important? Because that's one of our mission statements of our centre, you know, is to try and get this focus back on children and childhood.
Yeah, absolutely. Because, you know, sort of like, as I say, that surgery at 9, like I joke people that my proudest achievement in life is, I don't know whether I mentioned that in the, but is that, you know, he got the right surgery at the right time. It's, you know, it's the single most proudest achievement I have in life, is that I listened to the research and he got the surgery and it had a brilliant outcome, you know what I mean? But that set him up for life. He had that at 9, you know, that has impacted his life today, you know what I mean? And absolutely, like, what we do with children has a life course impact, you know what I mean? That's why, you know, sort of, there's so much we need to do for children, you know, because, you know, it impacts so much, you know, over such a long period. So, you know, sorry.
Oh yeah, I agree with you. And Eleanor just said maybe the books could be extended into the neonatal period. So everybody wants to keep you busy. A lot of books. Kieran Sims said, very nice talk, but in that example dealing with the wishes of the child and the wheelchair, might there be a long-term cost to the child using the wheelchair exclusively too early? It's
Of
a
course,
point.
like everything is a balance, everything is a balance, but the social costs as well, everything is a balance, absolutely. But, just the social need of the child at school is very important as well.
Yeah, and
So I'd
I would,
agree with Kieran, it's a balance, but maybe, sort of there's a way of achieving both, you know what I mean? But it's and you made the point earlier, it's the voice of the child as well, you know what I mean? Like, we parents and like, sort of like, parents will have one thing that they're, one sort of that they're really trying and believing they're doing the best for the child. But the child is not, it has to have a voice too in the conversation. Like there's a clinician, there's a parent, there's a child, and the child, as they get older, their voice has to be heard, as well. You know what I mean? And so it's a balance.
it's a balance, and I think you've made that point really well, Lily. It is a balance, and I think the other point that you made about the power of one and impact, not necessarily achievement. Could you maybe leave us with an inspiring message as to, what else can be done with the power of one, in the area of children's
Well,
well-being?
I just say never, sort of never just underestimate what the impact you can have, because most of us, have sort of don't go around, thinking, most of us underestimate our, what we can achieve. Do you know what I mean? Or the impact we can have. You know what I mean? So what I'm saying to people is, don't like. I was an ordinary parent with my A plus in retirement, and like I'm kind of, sort of surprised that you could actually, who knew that books could have such influence? You know what I mean? Who knew? Because when I wrote that book, I didn't know whether anyone would read it or not. You know what I mean? I wrote it blindly, no market research, didn't even ask anybody, just put my head down and started writing. You know what I mean? I had no idea. So what I'm saying is, you never know the impact you can have, but focus on impact rather than achievement. You know what I mean? I care far more about how many books are get out there to families than how many books are published. How many books are published doesn't matter. It's how many get out to families. You know what I mean? And it's to make them, to get to reach families, you know what I mean? That's far more important. And it's the impact on families that I really care about, not, the rest doesn't matter, you know what I mean? And it's if we can think of impact.
Mm. I think that brings us to a close. I don't see any more questions coming through. Just a comment from Anne to say that, she had virtually no support when Anya was diagnosed,
Yeah.
and that badly needed is care coordinators across the board, and they've been very successful with a paediatric clinic and now are working to get a 22q11 lifespan transferable model of care pathway.
And
So
look what
parents,
she has achieved. Look what like what Anne is achieving in her, like she had a child with a condition, and look who's now an adult. But look, what? There's another power of one.
absolutely. And I'm going to leave on that a message because it's really inspiring. And I would like to, on behalf of everyone who attended today and on behalf of our Trinity Research and Childhood Centre, to thank you very much, Lily, for giving us your time and your talk today. It was really inspiring.
Okay. Thank you very
Um,
much. Thank you, everybody, for coming to it.
And some of the comments coming through is thanks, Lily, as one lioness to another. Thank from Professor Lorraine Swords. Thank you so much, Lily. Great talk. Many thanks from Kieran. Thanks from Arthur. So very enjoyable. So I will leave you at that, and Jenny will put the recording up as we always do. And thank you very much again, Lily.
Keep up the great work you're doing.
Thank you.